Breast cancer is the most frequently diagnosed cancer. 1 in 8 women get cancer, which is why we are talking about breast health. Dr. Kyle is a health expert. She is here at Women's Care. And today we are going to be answering some of the most frequently asked questions when it comes to exams and cancer. So Dr. Kyle, how can we diagnose early?
That's a great question. The ways we can diagnose early include self-breast exams and a mammogram. Mammograms can diagnose breast cancer a year and a half before we can feel it. To feel it, the best way is doing self-breast exams. The way I tell my patients is when you're in the shower, usually the week after your period is the best, and what you want to do is make small circles all the way around. What you're feeling for is something that feels hard and calcified in the normal lumpy bumpy tissue that's there. We like to describe that lumpy bumpy tissue as oatmeal, and what you're feeling for is a rock in your oatmeal. You want to pay attention to the skin for any skin changes, and also for any nipple discharge or areas that were more painful than others. All of these things you want to tell your doctor when you go see him or her.
So Dr. Kyle, what do you do if you feel a lump?
The first thing you do when you feel a lump, if you feel a lump, is to call us. We always reserve spots in our schedule to make sure that anyone with a concern gets in quickly. And what we might do while you're in the visit is to examine your breast, talk about exactly what you're feeling, and also order any imaging that's needed.
We have some images to help you understand a mammogram a little better. How does it work?
A mammogram works by transmitting these x-rays into this plate, which is digitally enhanced so that we can see all the minute detail in it. This is the image that we get. So as you can see here, this is 2 images on a normal 2D mammogram, and there are areas of darker tissue, which is the more fatty tissue of the breast, and areas of lighter tissue, which is the more dense area of the breast. There are 2 different kinds of mammograms that we order. A screening mammogram is what's done every year to every other year. A diagnostic mammogram assesses a particular area of concern. What this image shows us is why a 3D mammogram is really special. So as you can see here, this 2D image shows some whiter tissue in places, but then as you take those 2D images out and make the 3D images the 1 millimeter segments, we actually could detect a breast cancer right there. And as you can see, those extensions into the tissue around it, which were much more difficult to see on this image. One of the other things that makes this mammogram machine truly special is that some women are able to have the curve stabilization system. What it does is it allows the tissue to be compressed slightly, but not to feel the real squish. I like to say that it gets the greatest quality for the least squish.
So a question you probably get asked often, how frequently should women get mammograms?
That's a great question, and the answer varies a lot according to which governing body of medicine that you listen to. We at Women's Care generally follow the recommendations from the American Congress of Obstetricians and Gynecologists. They recommend that mammograms are done every other year between age 40 and 50, and every year after 50. The decision of when to stop your mammograms really is a conversation between you and your physician.
So technology is constantly changing. What is the difference between a 2D and 3D exam?
A 2D exam is detecting the x-rays go through a plate, and that might be computer assisted. A 3D mammogram separates these images into 1 millimeter thin segments.
And lastly, how does your family history affect your risk for breast cancer?
It's really important to talk to your doctor about your family history. We're looking for a lot of different cancer types in your family: breast, ovarian, uterine, prostate. And we're looking for the patterns that occur in your family history. It's really amazing we live in this day and age that we could actually now prevent different types of cancers by screening for genetic history and doing risk-reducing surgeries for that. So please talk to your doctor about your family history.
Dr. Kyle, thank you for educating us on breast health. You can find more of our videos on YouTube. Make sure you subscribe to them, and you can find additional videos on womenscare.com.
It's been my pleasure to talk to you today and do those self-breast exams.
Yeah.